everyone. Today we're going to continue this semester on with the muscular system. Last semester we started the muscular system and we talked a lot about the microscopic anatomy of an individual muscle cells. How do those muscle cells send a signal or get a signal? How do they cause movement? And then we've also talked about how do they get energy and how are they affected by exercise. In this semester, we're going to focus on the muscular system in terms of the gross anatomy. So, body movements that we are able to physically see without a microscope, and then muscles that we're able to see without a microscope as well. So, to get started, we're going to talk about the 5 golden rules for understanding skeletal muscle activity. Here are our 5 rules, and I'm going to go through each of these in a little bit more detail and define some of the vocab terms that you might see on this here in the next couple of slides. Rule number 1 says, with a few exceptions, all skeletal muscles cross at least one joint. And we have to remember a joint is where two bones meet. If we recall from our skeletal system and our muscular system early on, those two work together in order to produce movement. So it makes sense that muscles have to cross at least one joint in order to make the bones move. Rule number 2, typically the bulk of the muscle is going to lie proximal to the joint that is being crossed. So again, proximal means closer to the point of attachment. And again, bulk of the muscle, the big chunk of that muscle that's going to do a lot of the work, again, is going to be closer to the point of where that limb attaches. Part 3, all skeletal muscles have at least 2 attachment points. The first attachment point is called the origin, and the second attachment point is called the insertion. If you take in health class, these are terms that should have been mentioned by Mr. Jackson when you guys go over muscle movement. Step 4, skeletal muscles can only pull, they never push. And then step 5, during contraction, the skeletal muscle, the insertion or the insertion point of a muscle is always going to move towards the origin. And again, like I said, in health, you should have covered these terms, but if not, we're going to define them here in the next couple slides. Okay. So here is just a picture of a muscle contracting. Here is an origin point, and we're going to again define that word. Down here, this is going to be my insertion, and this is a good example of the insertion always moving towards the origin. So this muscle is going to pull basically your forearm up. Okay. So when I said we're going to define those 2 points, again, muscles attach at no fewer than 2 points. We always have at least one origin and one insertion. An origin is going to be defined as the attachment to an immovable or less movable bone. So if we go back to our picture of our arm, typically when you are flexing your arm or pulling your forearm up, your humerus bone does not move, but your forearm does move up. That comes into the definition of insertion, and this is going to be attachment to the movable bone or the bone that's typically going to move. Now, when the muscle contracts, like we said on the last slide, the insertion is going to move towards the origin. Another thing is some muscles have interchangeable origins and insertions, and this is going to depend on what action is being performed. Are we flexing or are we extending our arm? Body movements also occur when muscles contract across joints. Again, that's what causes bones to move. So we're going to first talk about the major types of body movements. One of the ones that most people are familiar with is flexing. We call this type of body movement flexion. The whole definition of this body movement is it decreases the angle of a joint. So if you think about it, when you flex your arm, you're decreasing the angle of basically your elbow. Another way to define this is it brings 2 bones closer together. This happens a lot with hinge joints, so you bending your knee back or your elbow. And it can also happen at ball and socket joints. So for example, if you bend over, you are basically bringing the upper half of your body closer to the lower half of your body. So bending forward at the hip. Okay. Extension, this is going to be the opposite of flexing or flexion. This is going to, instead of decrease the angle, this is going to increase the angle between two bones. So typically, if you already have a bent elbow or a bent knee, this is going to be straightening those things out. Or if you're bent over, this is going to be standing back up straight. There is a special type of extension called hyperextension, and this is when you extend beyond 180 degrees. So this is going to be like taking your arms and moving them posteriorly, which means behind. So moving your arms behind you, like if you're stretching, or tipping your head back where your chin starts to point up. You're hyperflexing your head. So here is a couple images of this. Is going to be flexion, again, is moving up, would be like, for example, bending your arm up, bending your knee back. Extending would be straightening your knee, putting your arm back down. Hyperextension would be, instead of having your arms at your side, pushing them a little bit further back. Another type of hyperextension is going to be pushing your neck super back where you're looking up. Flexion is like taking your head and looking down. Another type of movement is called rotation. This is going to be movement of a bone along a longitudinal axis. This is very common in ball and socket joints. A good example of rotation is going to be like looking left and right, shaking your head no for that. This would also be a good example of you moving your arm left and right. So a good example of this is moving the atlas around the dens. If we remember, our atlas is our first bone in our vertebrae that holds our head. So again, here is some body movements. Rotation would be like shaking your head left and no. Here is a lateral and medial rotation of the ball and socket joint in your leg. So for example, you can move where you can point your toe out, and then you can move your foot where it points back in, etc. The other two types of body movements are abduction and adduction, and these two, we talk about them together because they're kind of opposites one another. Abduction is going to be movement of a limb away from the midline. So like if you're abducting somebody, you're taking them away. So again, away from the midline. This is going to be like you raising your arms or legs, spreading your fingers or toes apart from one another is a special type of abduction. Adduction with ADD, like you're adding something, is going to be the opposite. So you're going to actually add something or bring the limb closer to the midline. So lowering arms or legs. So one that I like to say for these is going to be abduction is going to be like when you spread apart your legs away from the midline when you're doing a jumping jack. Adduction is when you're going to be like trying to bring them closer to the midline, kind of like if you're horseback riding, or you have to kind of squeeze your thighs together to bring them closer, or you adduct muscles help hold on to the saddle. And then the last major type of body movement is circumduction. Circumduction is a combination of flexing, extending, abducting, and adducting. These are super common in ball and socket joints, and a good example of this is going to be when a softball pitcher kind of like does their pitch. The proximal end of the bone is stationary, so if we think about a softball pitch, that's going to be where your humerus attaches into your pectoral girdle, and the distal end tends to move in a circle, so like if you do big arm circles. Again, here is abduction, moving the arm away. Adduction is moving it towards the body. Circumduction is, again, when you make circles with your ball and socket joint. Again, a big windup in softball would be a good example. Or another good example of this would be a volleyball serve. So if you go to serve a volleyball, overhand would be a good circumduction movement. Now, there are special types of movements depending on where they're located and what exactly is happening. And so these are going to be a few special type of movements we talk about. The first one is dorsiflexion. This is going to be like lifting the foot so that the superior surface or the top of the surface of your foot approaches your shin. So if you were going to point your toe upwards. Plantar flexion is going to be a little bit different. It's going to be the opposite of dorsiflexion. Plantar flexion is going to be pointing toes away from the head. So more about pointing your toe down. If you are a ballet dancer, you tend to do a lot of this. You point your toes down and get up on point. Also, you tend to point your toes away from your head when you go to press down on a pedal to drive a car. So those are very good examples of this type of special movement. Again, dorsiflexion is when we point them up. Plantar flexion is when we extend them down. Another type of special movements that are opposite of each other are inversion versus eversion. Inversion is when we take the sole of our foot or the bottom of our foot and we extend it medially. Remember, medially is towards the center of our body. A good example of this is if you were to look at the bottom of your foot, you may roll your foot inward to kind of see if there's something on the bottom of your shoe. Eversion is going to be turning the sole laterally or away from the midline. And so here's a good example. Again, inversion is where you kind of turn it inward, kind of if you were seeing if something's on the bottom of your shoe. Eversion is going to be the opposite, where we tend to turn it the other way. Okay. The other types of movements is supination versus pronation. These two are often our most confused terms. People have a hard time with this. Supination is defined as the forearms are going to rotate laterally or they're going to rotate outwards. And so our palms are going to face anteriorly or towards the front. So for example, if you had your hand down on a piece of paper and you flipped your hands over so your palms are up, that is going to be a supination movement. It's where you move your body into anatomical position. Palms forward, thumbs out. Typically in this position, your radius and your ulna, which are two bones in your forearm, bones in the forearm, these are typically going to be parallel when you're in that position. Pronation is going to be forearms are going to rotate medially or towards the inside. So your palms are going to face backwards or posteriorly. And when you do this, your radius ulnas tend to cross each other and form of X. So if you are somebody who likes to play that little game where you keep your palms up and then you try to turn them over super fast to slap the top of people's hands, that is going to be you moving your arm in a pronation position. So again, supination is turning your arms with your palms forward. Pronation is where you turn your arms backwards. One way that your book says to remember supination is when you're actually scooping up soup to put it into your mouth with a spoon. Typically, you're making that kind of motion, your supination motion. And this is the last one we're going to talk about. It's called opposition. Opposition is a special type of movement where you actually move your thumb to touch the tips of your finger. So if like you're going to pick lint off something, you're moving an opposition movement. So when you touch each of your different fingers with your thumb. Okay. And that's all we're going to talk about for body movements for today. And if you have any questions, please make sure that you ask. And I hope you guys have a great day.